Welcome back. This is the Now program on TTT, and you can catch us on Facebook as well and TTT Live online and on Talk City 91.1 FM. And we're talking this morning about glaucoma. And as I mentioned before the break, as someone who basically started wearing glasses at 8 years old, this is one of the tests that you tend to go through as you get older as well. And it's very important that you know about glaucoma, that you get those tests done, whether you wear glasses or not. And to talk to us this morning about it is Niall Farnan, who is an optometrist and lecturer at the University of the West Indies, St. Augustine. So good morning.
Good morning, Ria. How are you?
I'm good, thank you. And I heard your commute this morning was well this morning because of the early morning. So that's good. And you saw well on the road.
That's it.
Now, tell us, glaucoma, it is actually one of the leading causes of blindness, not just in Trinidad and Tobago, but worldwide.
That's it.
Exactly what is glaucoma?
Well, Ria, glaucoma is a group of eye diseases that, if left uncontrolled, will make people lose their side vision. Now, a lot of viewers at home may say, well, I don't need my side vision. I can see down the road plenty. I don't have any problem. But, you know, when you're driving, even walking down Charlotte Street, High Street, if people bump into you, that's a sign that you don't have side vision. And one of the dangers is you could be losing it for 3 to 5 years and you won't actually know about it.
How is glaucoma diagnosed? I mean, do you, as a person, see differently, feel differently?
No, that's the unfortunate thing. By the time a patient notices it, they could have had it for 3 to 5 years.
Wow.
And so there's no immediate loss of vision, there's no pain, so there's no symptoms at all. And that's why it's so important that we go and get ourselves tested for glaucoma.
At what age should we start getting tested for glaucoma?
Well, for some reason, people over the age of 40 seem to be more at risk. And so if anybody has never had their eyes tested and they're over the age of 40, that's a great time to start. And then after the age of 60, the risks increase even further. So it's important, you know, if you haven't had it done by then, to definitely do it. But there's never a best time to get your eyes tested. Even children should have their eyes tested because there are some forms of glaucoma that can happen in children. And so it's important that everybody is aware of the disease.
Why do you think, though, that it's so difficult to get someone to go get their eyes tested?
Well, you know, sometimes they're actually afraid of the outcomes. They would have seen granny who had cataracts or granny who had glaucoma, and back then there wasn't much that could be done. And so they would have just seen granny lose their vision and they just assume it's going to happen to them. And so sometimes it's that fear of actually hearing something. And of course, you know, the mind can do tricks on us and overcomplicate things. So that is one of the problems, just a fear of knowing that maybe something is wrong.
Do you think that more should be done, though, as well, in educating people? Because, yes, there is that fear. But, I mean, if you see granny getting like this, do you really want to be like granny, or do you want to prevent it? And, you know, have that preventative sort of training before and get the message out there that, listen, your eyes are important and you need to take care of them.
And that's why it's great to be here this morning, because the message certainly needs to get out there, you know, that, as I said, people at home could be looking at this and have glaucoma and may not know about it. And then it's just an eye exam that would be able to help them to be able to pick it up, diagnose it. And nowadays, the treatment is a lot easier than ever before. And so that's where, as you say, the education is so important.
Now, glaucoma, when it's being tested, what does it look like in the eye? What is the test like, and what does the eye look like that says this is glaucoma?
So for us to see the vision, it's the optic nerve, the back of the eye, that has all the signals coming from the actual focus of the lens. And that optic nerve looks bigger than what it normally would. And that would make us suspicious of glaucoma. And then there's a test called a visual field test, which is where they show dots around the screen. And that also measures the side vision. And then pressure is another reason. The pressure in a person's eye could be high for that eye. And they're the 3 main signs. So we check for the pressure, we check for the look at the back of the eye, and we check for the side vision test. And that's how we could say that a person has glaucoma.
But there's nothing that's painful in those tests?
No, it's all very easy. It's all very routine. And when they go to the optometrist or the ophthalmologist, we would be checking for that, yes.
How does one treat glaucoma, though, if you're found to have glaucoma?
Well, that's the thing. Once it's caught on time, nowadays it's just a case of using drops. But if it isn't caught on time, you may need surgery. And so that's where it's all about making sure we get it on time. Now, you know, for some people, they get a little bit vexed having to use drops. But I mean, you know, if it's once a night or twice a day and it prevents you from losing your vision, you know, we strongly recommend that people use the drops as much as possible.
And it's not reversible either.
That's the problem. There's no cure for glaucoma, so we can't prevent it. So if it's going to happen, we need to pick it up as soon as possible. And the damage that has been done is done forever. And so again, we want to make sure we get our patients before any damage is done, put them on eye drops, and they're on eye drops for the rest of their life, which again, people don't like. But again, the other consequences are severe.
Yeah. Now, you said that it's pressure on your eye, and even children get it. At what age should parents basically take their children to get their eyes tested? Because with me, and I'll tell you my personal story, it's only when I started, I couldn't read the board at school, that my parent, oh, something's wrong with her eyes, and I was 8. They were a little bit better with my brother because of what happened with me. But so many parents go through that as well, not realizing that their children do have eyesight problems. So at what age should testing start?
Well, we would normally recommend exactly what you said, maybe just before they start school, because that's when these things could be picked up. Now, before then, I mean, again, there's never a wrong time. If you're suspicious, as we say, your child has a cokey eye, anything like that, then, you know, don't, because it's not going to grow out. If you have a child has a cokey eye, then it needs to be done very, very quickly. And a lot of parents just presume it's going to grow out. So anytime a parent is worried, suspicious about the child's eyes, that's when we would recommend to go ahead and have the eyes tested. But again, for the child's sake, just before they're going to school, so this time of the year is the perfect time to do it. They're finishing school now, they're going to have a summer vacation, and then they may be going on to secondary school or primary school. That's the perfect time during the summer to do it.
Things like diabetes, high blood pressure, and these other sort of lifestyle diseases, how does that affect glaucoma in any way, and how does it affect it if it does?
Diabetes for sure. So we had one of our other colleagues on Monday talking about diabetes. There is a strong link between diabetes and glaucoma. But the likes of hypertension, it hasn't been shown yet. But, you know, the risk factors are age, as I said, for some reason, once a person's over 40. The other major thing is genetics. So if you have somebody in the family that has glaucoma, then you need to be very concerned about it, particularly your brother or sister. So if you know a brother or sister has glaucoma, then you should be getting yourself tested regularly, or of course your parents as well. And you know, sometimes we're afraid to talk about health, as you were saying. So you may have glaucoma, but we haven't told anybody else. And so I would say to the viewers at home, if you have glaucoma and you haven't told your brothers and sisters, or you haven't told your kids, well, you know, now's the time to have that conversation, because there's a strong link. Another risk factor is if your ethnicity is Afro-Caribbean, you're more likely to have glaucoma, but also it's more likely to be more severe. And remember, there could be a 3 to 5 year gap of someone having it and not knowing it. And so if you're Afro-Caribbean heritage and then you have it, it's going to be very severe over those 3 or 5 years. So that's why it's important that we pick it up as soon as possible.
All right. All right, I want to thank you so much for taking the time and coming to tell us all about glaucoma. Very serious, and we need to nip it in the bud before it gets any worse. Now, Farnan, optometrist and lecturer at the University of the West Indies, St. Augustine, thank you so much once again.
Thank you very much.
Here on the Now program.